All right, now I'm going to talk you through a paraffin wax treatment. You're not going to be able to practice with this paraffin wax at home unless you have a paraffin wax bath, and if you do, great. If not, then just watch me do the treatment. I'm going to show you paraffin wax for scar tissue. It works really well for scar tissue, but you can also apply the same principles. The reason why paraffin wax works so well for scar tissue is that it's a heat treatment, and the addition of paraffin, which its main constituent is mineral oil, makes it so that it penetrates even deeper into the tissues, so that the heat penetrates even deeper into the tissues, and then you can get in there and do some really good massage work. But heat also works, so I want you to try a scar tissue treatment with a heat source as well, and I will show you this paraffin wax. So Paige's knee here has a scar. This is a fake scar, obviously, but her actual knee does have scar tissue in the area. She tore her MCL. It wasn't a visible scar. She didn't have surgery or anything, but scars, for surgical scars, scars from injuries are really great to work with paraffin wax. You just want to make sure that you understand if the area is deprived of any sensation, make sure you have a conversation with the person. Maybe you do some superficial pain assessment in the area. You never want to apply a strong form of heat somewhere where they can't feel anything. If they have a slightly less feeling in that area because of the scar tissue, it's okay. We can still do a heat treatment. We're just going to make sure we check in on it very closely. And possibly doing this scar tissue work in the area may loosen up some of those collagen and elastin fibers and create more blood flow to the area, so that some of that nervous system sensory deprivation can actually heal itself, and you may even get the person to experience more sensation in the area. So before you apply paraffin wax, because it's a wax, we don't want it to stick to the skin or the hairs on the skin, so we have to apply what's called barrier cream. We have this at the clinic. It's a very thick cream. It doesn't soak into the skin too much. It sits on the surface of the skin, so it makes the wax really easy to remove. So I'm just going to apply a little bit of barrier cream to the area. It's not even necessary to do massage or anything in this area. You would have assessed the tissue already. I'm just going to apply a little bit of barrier cream. I don't even have to rub it in because I don't want it to soak into the skin too much. We want it to sit on the surface of the skin so that the wax is easy to remove. Now I have a little paper Dixie cup. I went and dipped it into the paraffin wax bath. I have some hot paraffin wax here, and I have a foamy brush, and this is how I'm going to spread the wax onto the skin. I would have explained this treatment already to my client. I would have explained what paraffin wax is. I would have made sure that they don't have any allergies to things like mineral oil. I would have asked them if they've ever had this kind of treatment before. Sometimes you'll see it in spas or at estheticians. They put your hands in paraffin wax or your feet in paraffin wax before they do manicures or pedicures. So maybe some people have had experiences with it already. I would have explained the benefits of it. This is a heat treatment. It's going to penetrate really deeply into that scar tissue so that I'm able to get in there with some massage treatment that's going to break up some of the adhesions in your scar tissue and make it more malleable. Maybe it'll improve the range of motion in your knee. Maybe you'll achieve some more sensations there. Explain some of the benefits. Explain that it will go on very hot. We're going to do it on an exhale, so I'll get you to inhale. On an exhale, I'm going to apply a layer of paraffin wax. It's really hot at first, and then I'm going to apply a few extra layers, and you'll immediately feel the heat go down. It's really kind of a quick heat, and then as I apply a few extra layers, the more layers I put on, the more insulated it becomes. And then I'm going to apply some plastic wrap to keep the wax away from the towels. And then I'm going to apply a heat source on top of that, wrap up the knee, and I'm going to leave it there for a few minutes to allow that heat treatment to soak in before I remove it and get in with my massage treatments. So here's what that looks like. So Paige, I'm going to get you to take a nice deep breath in, prepare for some heat. And on the exhale, I go ahead and I apply the paraffin wax and keep breathing, nice deep breaths in and out. And we apply a few layers. You can see the layers get thicker, and as they get thicker, they become even less and less, it becomes less and less hot. It doesn't feel as hot the few layers that you get on. Now you can do this over a small area like we're doing, or you can do it over a large area. Like I've done these over the low back. You can do them all over the low back and then apply a heat source there, and that's just gonna add heat to your lumbar treatment, and you can do it over muscles. It doesn't necessarily have to be over scar tissue. So I have a few layers there. I'm gonna come put my paraffin wax down, and now I apply a piece of saran wrap, and I've prepared all of this stuff in advance. I'm not running back and forth. Oh, I forgot the saran wrap. Make sure you have all the supplies that you're gonna need. Then I'm gonna put the saran wrap on. That's gonna insulate that wax and make sure it doesn't get onto any of my towels. And then I've got a heat source here, so I have a hot water bottle with a few layers of towel, and I'm gonna place that on and wrap her knee up in that. Thank you. And then I'm going to cover her up and allow that to do its work. I'm gonna go elsewhere and do some other work. Maybe I'm even gonna work in the foot or the lower leg here while that heats up. And I'm gonna check in with her and make sure that it's not too hot, that she's not experiencing any signs of hyperthermia, that it's not feeling uncomfortable in any way. And I'm gonna check on the skin and make sure it's not pinking up. And when it starts to pink up and get warm and sweaty, especially it'll get more sweaty because of the saran wrap there, then maybe say after 5 minutes or so, I'm gonna remove it depending on how she's reacting to that, 5 to 10 minutes. Then I can come in and remove it so that I can get in and do my massage work. So what I like to do is loosen the wax with the saran wrap, so you're not actually having to pick wax off. This comes off really easily, especially if you've applied enough barrier cream. So I've just sort of loosened the wax with the saran wrap. Oh look, her scar ran. So there, comes off really easily. There's no wax on my hands, easy, ready to go. Usually the skin will be really malleable. I didn't leave it on for 5 to 10 minutes, but it's usually really pink and kind of sweaty because of the saran wrap and the heat. And now at this point, I can go in and apply some deep work. So for scar tissue work, you can do some skin rolling. You probably learned that in myofascial class. So you can do some skin rolling around the area. I like to go in all directions, so horizontally, vertically, and on an oblique angle over that scar tissue. You can pick it up and sort of make an S curve with it and do all of your scar tissue treatment at this point. And that's a really great addition. So that's a paraffin wax treatment.